Assalamualaikum and salam sejahtera to my beloved lecturer, Madam Ashrani. For my informative speech, I have chosen the topic Symptoms and Causes of Bipolar Disorder. The reason why I chose this topic was because of the television series that I watched, Spinning Out. The main character's mother experienced bipolar disorder throughout the series. Since the mother experienced bipolar, the main character also suffers from bipolar disorder. So, what is actually bipolar disorder? Bipolar disorder is a mental health condition that happens when someone has abnormally active, extreme mood swings, or depression. Examples of extreme mood swings are mania or manic and hypermania or hypermanic. Hypermania is the milder version of mania that lasts for a shorter period, which is usually a few days, while mania is more severe and usually lasts for a week or more. Next, these are the symptoms of bipolar disorder. According to research from the National Institute of Mental Health, NIMH, about 4.4 of US adults have experienced bipolar disorder. Based on another study by Psychiatry Malaysia, an estimated 1% of the population suffers from bipolar disorder, which is about 250,000 people. There are different types of bipolar disorder: bipolar 1, bipolar 2, cyclothymic disorder, and other types they are mainly affected by drugs and alcohol abuse. Furthermore, common symptoms for a bipolar episodes are depression, either insomnia or sleeping too much, fatigue or a loss of energy, either agitated or slowed behavior, and attempts at suicide. In addition, bipolar disorder isn't just possible for adults. It can start as young as 6 years old in children due to trauma, stress, or depression. So, what is actually causing this mental health condition? Unfortunately, the literal cause of bipolar disorder has not yet been discovered, but the common factors are biological differences and genetics. Bipolar disorder happens when the patients experience structural abnormalities in their brains that cause them to have manic episodes. People who have a first-degree family member, such as a parent or sibling with the disorder, are more likely to experience it. Experiencing high stress or drug or alcohol abuse would make a person more likely to experience bipolar disorder too. Even though the symptoms are only eligible if they are severe enough and cause difficulty with daily activities, nevertheless, minor episodes of these symptoms that are noticeably severe also need to be brought to the doctor's attention, especially among children and teenagers. Moreover, people with bipolar disorder may also have other health conditions. For example, anxiety, eating disorder, attention deficit or hyperactivity disorder, which is ADHD, heart disease, or obesity. To conclude this topic, I believe that actions need to be taken immediately when there is a warning sign, because prevention is better than cure. Early symptoms that can be found, especially in youngsters, need to be prevented from developing into something worse. The symptoms are actually common in our modern society since we are more exposed to the technology. But we should never self-diagnose ourselves, especially with this kind of serious diseases. Hence, it is always a good idea to go to the doctor for further confirmation. Bipolar disorder is a lifelong condition that can be controlled by a treatment plan such as medications or psychotherapy. Therefore, we need to start taking any minor symptoms seriously, especially when we have a first degree family member who experiences bipolar. If you have the symptoms, start doing regular exercises to help reduce the stress. If you know someone who is experiencing bipolar, be patient and understanding, motivate them and listen to them. Hopefully, we could successfully prevent the episodes from worsening. That is all from me. Thank you.